Hi, I'm Dr. Joseph Bentivegna. I'm an ophthalmologist, an eye surgeon, and I've been practicing medicine for 35 years. As many of you know, our country is in the middle of a healthcare discussion. It is my opinion that the present system will not work and that the improvements being proposed will not work either. Recently, I had a letter printed in the Wall Street Journal in which I proposed single-payer catastrophic coverage for all Americans. What this would mean is that you would be covered for families for bills that exceeded $75,000 a year, and for individuals, bills that exceeded $50,000 a year. You would then purchase insurance to cover this deductible, which would not be that expensive. Now, doing this would not require a huge new government program. We already have a program called Medicare, which protects our elderly and disabled. All we would have to do is extend this program to cover all Americans. So if you'll bear with me, I'll explain to you why this will work. Please take a look at this graph. Notice how wages since 1960, after accounting for inflation, have increased only 16% in this country. However, healthcare costs have increased over 800%. This has made healthcare unaffordable to many people. And you can see it in this chart here. Notice how wages since the year 2000 have hardly kept up with inflation, but healthcare premiums have skyrocketed to almost 200% higher. Now, many of you watching this will blame the doctors, or the lawyers, or the government, or the insurance companies. Many of you will blame all four. But the real villain here is technology. Over the past 60 years, healthcare has greatly improved, from hip replacements to cataract surgery to heart treatment. All sorts of treatments and medications have made healthcare much better for everybody. And this has caused huge increases in costs. 60 years ago, a pound of coffee is the same as a pound of coffee today. A gallon of gasoline is the same as a gallon of gasoline today. But healthcare is much improved. And this leads to another problem. Now, I don't want to drive you crazy looking at charts here, but this chart is very important. If you take a look here, this shows the percent of spending according to percent of the population. In other words, 1% of the people account for 22% of our healthcare spending. 5% of people account for 50% of our spending. And if you look here, 50% of people account at the bottom for only 3% of our healthcare spending. So because of increased technology, we are seeing a small percent of the population, 5%, account for almost 50% of our healthcare spending. This has to be understood before we can solve this problem. Because of this advancing technology, a group of citizens emerged in our country who could not afford health insurance, our elderly. So our political system responded in the 1960s by creating a system called Medicare. This was a government medical program that covered those 65 and over. And it worked quite well. But over time, the technology kept improving, and a new group emerged that needed protection. These were people with pre-existing conditions, people with high blood pressure, or heart disease, or AIDS, or diabetes, or cancer. These people generate huge medical bills. The way to protect these people is by extending catastrophic coverage to all Americans via our Medicare system. Here, let me show you something. Take a look at this chart. Leading causes of personal bankruptcy in the United States. It's not divorce. It's not job loss. The overwhelming reason is medical expenses. Almost 50%, 43% to be exact. This just isn't right. And I know what many of you are thinking. How much would this cost? Believe it or not, it would not be that expensive. First of all, you are paying for many of these patients who are quite ill because of Medicare and Medicaid, and also because your hospitals are writing off the uninsured patients who don't have assets, and your taxpayer money is subsidizing these individuals. Our government takes in $4.6 trillion a year. A slight increase in the Medicare tax would cover this, and it would cost the average person maybe several $100s a year. Or simply we could move assets from other parts of our budget. That would be up to our political system. But it wouldn't be that expensive, and it would cover all Americans for catastrophic illness, so no one would go bankrupt. The other thing you need to remember is you will need to purchase insurance to cover this large deductible. But again, that would not be expensive either. Remember, many of you have homeowners insurance or car owner's insurance that has a much higher liability that is reasonably priced. The benefits of this would be huge. The main benefit is not only would everyone be covered, but it would be much easier to keep jobs in the United States because the corporations wouldn't be paying these outrageous health care bills. So I hope I've managed to convince some of you that